Hello, this is Dr. Behnam. I'm a board certified dermatologist, laser skin cancer specialist. I practice in the beautiful Santa Monica, California, and today we're going to be talking about warts. Warts is one of the most common skin conditions that dermatologists see in their clinical practice. There are many different types of warts. You could have warts on the face, which are known as flat warts. Typically, kids get them. The most common areas of warts that I see in my practice is on the hands. You could also have warts on the feet, known as plantar warts. You can have warts in the genital area, which is known as genital warts. Warts are caused by a virus known as HPV, human papillomavirus, and there are almost more than 100 different types and variations of this HPV virus. The most clinical presentation of warts on the hands is that they're raised skin colors. A lot of warts are kind of flat topped as well, and they have these black dots in them. The black dots, if you were to look with a magnifier, they're actually blood vessels because warts have a lot of blood vessels within them. So the question is, how do we treat warts? So the standard of care of treating warts is to treat them with liquid nitrogen. I know there is a knockoff version of the liquid nitrogen in the supermarkets. Unfortunately, that only freezes down to like -8 or 9 degrees. So it is not as powerful as the one that we have in our clinic, which goes down to like I think around minus 50 degrees. So when a patient comes in, the most important thing that I do is actually pare it down. See, if you don't pare down the wart, you're not going to get to the roots of the wart, which is sitting right at the base of the wart. You're just zapping the top of the wart, which is not going to do you any good. So anybody who comes in, we take a small blade and we pare it down. It doesn't hurt actually at all. Pare it down and then we zap the base of it with liquid nitrogen. The zapping, it's going to kill the wart. Wart treatments require that you have to come in every 2 weeks so that basically the area gets zapped again. Otherwise, you allow the wart basically to proliferate again. Besides the zapping, and in addition to it, sometimes I use something called canthicur. Canthicur or cantharidin is basically beetle juice. We just paint it on the wart. So a lot of times what I do, I pare it down, we zap it with liquid nitrogen, we put the beetle juice on it, and then we put a tape over it. I'm a pretty aggressive wart treater. I hate warts. Also, I have the patient a lot of times do some things at home. My philosophy with warts is that it's kind of going to a dentist. You go to a dentist and they do some dental work, but you go home, you're also going to brush your teeth every night. That's the same idea. When you come to clinic, we do some treatments to it, medical grade treatments. You go home, you're going to do something to it as well. Typically, I prescribe 2 creams. One is called Aldera. Aldera is a FDA approved cream for genital warts. We use it off-label for warts like other parts of the body. So after the blister heals, we have the patients apply Aldera, every other night or every night to the area. Also, I sometimes have the patient use a product called Mediplast. Mediplast is a special tape that is sold over the counter. It is basically salicylic acid 40%. The tape prevents basically all the wart from producing the rough, crusty, scaling lesion that typically we see. So at home, the patient are doing Aldera or even sometimes Rednay on the area and covering it with Mediplast. This will prevent the wart from coming back very fast within 2 weeks until I see the patient again. When I see the patient again, we evaluate the area, and if necessary, we pare it down, treat it with liquid nitrogen again, use the beetle juice on it again. So this is how I treat warts. I'm a pretty aggressive wart treater, but it works a lot of times. Warts on the feet, known as plantar warts, they take a long time for them to go away. I literally have patients that come in every other week for about 5 to 6 months. The reason is because they're very deeply rooted and you have to get to the bottom of it to completely basically take it out. The plantar warts, the ones on the feet, are sometimes and commonly associated with calluses. So you have to pare down the callus as well just to make it comfortable walking. In younger patients, or basically kids that have warts on their face, I typically try not to use liquid nitrogen. I try to use some creams like Aldura and Retin-A, basically on the area. It works in about 50% of the cases. In patients that are very young and they have a lot of warts, you could actually use Benadryl, oral Benadryl, to actually suppress the warts. Other medical treatments that I do is you could use a laser, which is known as a cautery, to actually zap the wart, and it works pretty well. Another laser known as a V-beam could also be used as well. In my experience, I think it could sometimes be effective. Finally, we could also inject the wart with what's called Candida antigen. If you inject it, this is typically done in patients who have a lot of warts on their body, that it is not ideal to zap every one of them. By injecting the warts with Candida, what we do is that we stimulate the immune response to recognize the Candida, which is a fungus, and to fight against the fungus. While it's recognized the fungus, it's going to also recognize the viral wart at the same time and fight against the wart as well. So again, so these were all the treatment methods that we use basically to treat warts. However, the most common ones that I use are liquid nitrogen, as well as Beetlejuice, as well as the topical creams. If you guys have any questions regarding warts, please visit our website, santamonicaskin.com, or call our office, 310-315-4989, for any additional assistance. We're here to help. Again, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist from Santa Monica, California. Have a beautiful day.